Hi, everyone. Thank you for joining. I see we still have a few people in the waiting room. We're trying to connect to audio, so we'll give them one more minute to join in, and then I'll go ahead and get started. Okay, we can go ahead and get started. Thank you all for being here. I know time is our most valuable and scarce resource, and choosing how to spend it is, especially these days in conferences, and there are so many things going on that it can often be difficult decisions in choosing how we want to spend our time and what we want to do. So I very much appreciate all of you for taking the time to be here for this presentation, to take this time to spend with me and hear about what we're going to talk about. For the next approximately 1 hour, we are going to go through this presentation that is called the Monolith Myth: How to Teach Counseling Students to Treat BIPOC Clients in a Culturally Responsive Manner. Here's just a little bit of background information about me. I graduated from the Johns Hopkins Clinical Mental Health Counseling Program last year in 2020, and I currently work as a teaching assistant and a research assistant with Johns Hopkins. As a teaching assistant, I have worked with our research course, but more specifically for this presentation, I'm going to be speaking about one of the courses that I was co-taught. Was called Individual and Group Dynamics, Behavior and Context, which was all about looking at individual, group, and systems level factors and how they impact the counseling space, and what we as counselors, our role as advocates for our clients. I also am currently a teaching assistant for our diversity and social justice course, and we'll be pulling in elements from that course as part of this presentation in going through how we as counselors in training, counselors in the field, and counselor educators can work to promote multiculturally competent counseling for our clients. I'm also a research assistant in a couple of different labs and centers at Johns Hopkins, also specifically focused on multicultural counseling practices. One of the research groups I'm in focuses on anti-racism in counseling practices and how we as counselors and counselor educators need to be responding to current events in teaching our students how to navigate the field of counseling these days to promote counseling that our clients not just need, but also deserve to be the counselors who they need us to be. So this is an area that is clearly of research interest and scholarship for me. I also want to stress that I am not an expert in this topic. Most of this presentation is going to be experiential in nature, in the sense that it comes from my experiences as a teaching assistant in a class that I taught last semester, and what I learned from it and how I think it can apply to our work as counselors. And and there are most likely people in this room who know more about this topic than I do, and I hope that during this presentation and afterward as well, that we can have a conversation to learn from each other. One thing that I stressed is that I'm a teaching assistant and not a professor, which means the idea of speaking for an hour straight sounds awful to me, and that I'm going to try and make this as interactive as possible. So before we move forward, I would like to get a sense of who's in the room. So if you can just type in the chat how you're entering the space, whether you are a counseling student, a counselor in practice, a counselor educator, or working in a different field. Welcome counseling students. Yeah, other folks feel free. Clinical psychologist, school counseling intern. Awesome. Cool, well, welcome social work, awesome. So we got a nice, great variety of folks in the room in terms of their counseling experience and how they enter the mental health field space. So just a quick note that this presentation comes from more of a counseling education background and working in counseling education programs. However, I do think it is also applicable to counselors in the field, whether in school or clinical settings. And as we move forward, I will do my best to share how it applies to that work in the field as well, in addition to counseling education spaces. So this is the session roadmap of what we're going to cover in the next 40 to 50 minutes. So first, we're going to go through the session objectives and what I hope you will all gain from being here, and what I hope you will get out of this presentation. Then we'll go through some definitions of this term monolith myth. I imagine that term is probably what drew a lot of you into choosing to sign up for this presentation. So we'll go through what I believe the monolith myth is, as well as a working definition of multicultural competence and what I believe multicultural counseling needs to be for clients in our world today. We'll then look at the impact of multicultural incompetent counseling, what is often called the one-size-fits-all model, and what the impact of that is for our counseling students, but also for clients, and how the adverse outcomes that leads to. And then we'll discuss how we move from that culturally incompetent counseling towards multicultural competent counseling. And for the counseling students and counselor educators in the room, the framework that I'm working from on this is really this notion of what kind of counselors are we training? Recognizing that one thing that I remember my internship supervisor told me on my first day of internship is a lot of counselors in the field shouldn't be counselors. That they're in it for the wrong reasons, and that I think it's imperative for all of us in counseling education programs as students, educators, research, however we enter the counseling education field, to take that responsibility upon ourselves to make sure that we are training multicultural competent counselors, and that the counseling students that are graduating from programs and moving to the field are counselors that we are proud to be counselors, because what we get to do as counselors and counselor educators is amazing. The impact that we can have on clients and society is incredible. And it truly is a privilege to be able to do what we do. And to paraphrase Uncle Ben from Spider-Man, with great privilege comes great responsibility. And that's what I'm going to be stressing today. The responsibility that we have based on the platform that we have a platform and a space to have an impact. And that gives us a responsibility to use that to advocate, to teach, and to train the counselors who we want to see in the world. And part of the way that we'll be doing this is going through an applied example and a model based on the class that I co-taught last semester, and then going through how that example assignment can be modified for you and your classes and courses, as well as for people in the field in your work with clients. And then we will finish with an activity. So here are the session objectives. And at the end of this presentation, my hope is that all of you will be able to recognize how assuming and treating BIPOC clients as a monolith is an example of culturally incompetent counseling. And I recognize that I'm using very specific and strong terminology here because I strongly believe in the impact that these words have, and in the notion that there is a difference between incompetent and competent counseling, and those words specifically because of the impact that it can have on clients. I hope that you'll be able to identify a pedagogical framework that promotes student learning and multiculturally appropriate counseling strategies, systems level advocacy, and the indelible link between them. That one of the primary things that we focus on and teach is that there is a link between the techniques and counseling strategies we use and advocacy, that we are not just counselors, we are counselor advocates. That is our responsibility. And to understand how there's a link between the two of them that we need to be imparting on students, and how our pedagogical frameworks need to reflect that and not just in our multicultural courses, but in all courses that we teach. Specifically, the assignment that we're going to be talking about today was not taught in a multicultural or diversity social justice course. It was taught in an elective, and that every single course and every single counseling program needs to be focusing on systems level advocacy and multicultural competence. You also hopefully demonstrate an awareness of how the monolith myth is not applicable to simple categories like privileged and marginalized due to the nature of intersectional identities that create unique lived experiences for each client. That there is, and I'll go through a little bit about the availability heuristic in a little bit. There's this notion of just, black and white thinking, dichotomous thinking, yes, no, A, B, up, down, and how oftentimes in counseling spaces, we want to view people as one of two groups, privileged or marginalized, and how that by itself, while well-intentioned and trying to make things simple, is actually what leads to what we'll be talking about as culturally incompetent counseling. We'll be viewing and then designing a sample assignment that you can use with students or clients, which fosters an understanding of variance between BIPOC groups. And lastly, you'll be able to explain how students can take actionable steps towards multicultural competence by connecting culture-responsive resilience strategies to systems-level advocacy strategies, and learn how to communicate this vision to students. So moving from those individual and group levels to the systems levels, and understanding resilience and advocacy and the link between them, and how to communicate that vision to students to make sure that when students are leaving our counseling programs, that they understand what multicultural competent counseling looks like and how that extends beyond the counseling office. That it is not just the 45 minutes you spend in a room with a client, it's a way of life, it's a way of being, it's how you exist in the world, and that it's so much more than what happens inside those four walls. So what you see up here is a screenshot of the assignment that was the catalyst for this presentation. That this presentation was born out of an assignment that I created for a course last semester, and I mentioned that the name of that course is Individual and Group Dynamics, Behavior, and Context. And essentially what it is it's a course that looks at both social psychology and personality psychology, and how those theories apply to counseling through the looking at individual groups and systems level thinking, really, and how to understand that how we treat clients has to be done through all three of those levels. And within that, we do that through promoting resilience and systems level advocacy, and thinking how the students in that course, we ask them to apply what they learn about individual group dynamics and resilience to foster systems level advocacy for their clients. So this assignment here we called the Trauma Protective Factors and Advocacy Conference, and it was a response to the dual crises, dual pandemics of COVID-19 and the police brutality that we saw that we've seen throughout history, really, but was heightened last year and continuing this year. Our goal was to have the students look at how COVID-19 had an adverse impact on specific minoritized and marginalized groups in society. And that includes specific racial groups, but also other groups as well, whether it was groups including the elderly or the homeless, to understand how marginalization does not just mean race, it means other groups as well. And we asked them to pick one of these groups and design a presentation explaining the impact that COVID-19 had on this group, and then move towards putting their counseling hat on and say, okay, if you have a client who is experiencing trauma from COVID-19 that is a member of one of these groups, what protective factor do they have based on their group? And how will you promote this protective factor? And then moving towards resilience. What does resilience look like for this group, for this individual? How will you teach a resilience skill to this client? And lastly, looking at advocacy. How will you advocate for this client? And again, what does that advocacy look like outside the four walls of the counseling office? So what we ended up finding out is that these students, we assumed that they would understand the difference between BIPOC groups, the importance of resilience and systems level advocacy for different groups, because these are students who are in their last semester of our program, that they have taken their diversity and social justice course. They have had their practicum experiences, they've had their internship experiences, and they're about to enter the field of counseling. And what we ended up finding was that we realized that these students who are about to graduate, they did not understand the difference between BIPOC groups. And we found that they were treating BIPOC as a monolith, that they were speaking of people of color as one entity. That again, going back to that, dual model of thinking of privileged versus marginalized, white versus black, that they did not recognize the inherent within group differences between these groups. And that's where this came from. So that's just a little bit of background on the experiential framework that created this presentation, and we'll be guiding it, and we'll be returning to this as we move forward. So I mentioned that this presentation is going to be interactive. So we have a poll question here, which I'm about to activate, which says, what are the barriers to the effectiveness of multicultural training and counseling courses? So I'm going to, there's a link at the top of your screen that you see to a poll EV website. I'm going to put the link in the chat for you as well, where you can go in and answer the following poll question from your experiences of what barriers you find to the effectiveness of multicultural training in counseling courses. And for those of you who are working in the field, what do you find are the barriers to effective multicultural counseling in your counseling settings? So you can go to the link that's in the chat there and put in your responses. Yeah, a couple people are putting in the chat language barriers, lifestyle barriers, that, yeah, certain things that can exist outside of our control that make, that present challenges to doing the counseling that we hope to do. Okay, so this here is how I'm defining what I'm calling the monolith myth. That the monolith myth is the notion that BIPOC, Black, Indigenous, and other people of color clients can be treated as a monolith without acknowledging the within and between groups differences among the groups. that, like we've said in that assignment, that students who wanted to talk about advocacy for people of color rather than focusing on specific individuals and specific groups, that they were not acknowledging the differences between those groups. And that this monolith myth, when we treat clients the same as without recognizing their unique identifiers, their intersectional identifiers, and their cultural background, we fall victim, we fall into the monolith myth trap. Which raises the question of why should we care about this? Because anything we do, it has to matter. For some, it may be obvious why we should care, but for other people, it may not be so obvious. That's because there's an increased need for multicultural competence in counseling for so many reasons. One reason that is very timely is due to the racial reckoning of 2020 and continuing today in 2021. And I put quotes around the words racial reckoning because I recognize that we all come from different backgrounds, are all in different places and enter the space in different ways. And that what for many people last year was a racial reckoning, for many others was just another day that ends in Y. That for many of us, what the events from the COVID-19 pandemic, police brutality, racism, hate crimes, for some people it was eye-opening, and it was the catalyst for them to take action. And for many other people, it was something that they've known their entire lives and that they've known for entire generations. And I wanted to be respectful of the differences of how we all may have experienced that, while acknowledging that it was still a large and significant movement, and that it was, I believe, the largest international protest movement seen in history. And what that did is it heightened this need for multicultural counseling from us as students, counselors, and counselor educators, because there are several implications of the failure to address the monolith myth when we see that there's a lower return rates for people of color in counseling. For people who come from marginalized backgrounds, they are less likely to attend counseling. And then beyond that, they're less likely to return to counseling because they may experience culturally incompetent counseling. And later on, we'll go through a few ways to, a few techniques and skills that have been shown to effectively increase the retention rates of these clients as well. And also the impact of toxic stress, or what others are calling things like racial battle fatigue, and that we have a professional ethical mandate to advocate for minoritized clients, that are clients who on a daily basis, the world that they exist in is one of toxic stress. It is one that is exceedingly difficult just to be in, and that it takes strength and courage and bravery to even come to a counseling space. And when they're in that counseling space, we have an obligation to not perpetuate the systemic inequalities that they see out in the world. Because if we do not provide multicultural competent counseling, the impact of that is worse. And that we as counselors, again, going back to, we have a privilege and responsibility to amplify voices and to be a part of the healing and catharsis that our clients need. So we have another poll question for you here. Hopefully this one works, which is, how do you see the monolith myth play out in your courses or professional counseling settings? So you can, again, go to that poll link. I'll put it in the chat one more time. You can go to that link and answer this question, or you can also put a response in the chat. Yes, thank you, LaDonna. One of the great things of virtual conferences and remote learning is that we can all join from our living rooms. One of the downsides is technological difficulties, and it looks like these polls unfortunately aren't working today, so I apologize that we're not able to have the interactive experience that I hope we could. But this is thankfully the last poll question. So we can go ahead and move forward. Hopefully you're all thinking about how the idea of this monolith myth plays out in your courses or your professional counseling settings, and keep those thoughts in mind as we go forward. So next I wanted to define multicultural counseling competence, because for us to discuss what it is, we have to know what it is, and specifically have language for it and specific terminology to refer back to for our students and for us in the field to know what we're working with. And the definition that I chose comes from the multicultural and social justice counseling competencies that were written by Ratz et al. In 2015 as a revision of the MCC, the Multicultural Counseling Competencies, written by Arcot et al. In 1992 and Su et al. As well. And so I'm defining multicultural counseling competence as counseling that, quote, addresses issues of power, privilege, and oppression that impacts clients, and seeing client issues from a culturally contextual framework and recommend interventions that take place at both individual and systems levels. So there are a lot of important words there that I want to pull out, starting with power, privilege, and oppression that impacts clients. And our clients exist in a world, they exist in systems, and it's one that involves power, privilege, and oppression, and how those dynamics play out for them. And when we see those dynamics play out, how we as counselors, counselor educators, must use a culturally contextual, and I would say culturally specific framework to use interventions that take place at both individual and systems levels, recognizing that our work as counselors, again, it takes place during what we do in the office with our clients during those 45 minutes within those four walls and in an individual level, but then outside as well, what we do at a systems level to advocate for them to dismantle those systems of power, privilege, and oppression that our clients face. And the reason why that is also important is because there are implications of in culturally incompetent counseling, specifically for our BIPOC clients, because one size does not fit all. What works for one client will not work for another client. What works for people from one group may not work for people from another group. And it's important for us to be mindful of it. And when we're training students, it's important to remember that I don't think this comes from malintent, that this type of thinking, this way of being, it comes from wanting answers. It comes from wanting to be good counselors. It comes from wanting to make things simple to know how to do them. And it's just the harmful heuristics of, I mentioned earlier, the availability heuristic of the brain attempts to simplify complexity as an adaptive feature. And for certain situations, that's great. Our fight or flight response, that saves us. That has literally saved our lives at many points in time. And because in those extreme situations, we need to rely on that. But in these spaces and in this situation, that same availability heuristic, the same duality process, simple process, ends up harming our clients because it blinds us to the diversity of differences within groups. And I put this image up here of intersectionality because it comes from Kimberly Crenshaw's work in intersectionality in recognizing that all of our clients have multiple identities, that they have a specific intersectional identity that is unique to them based on gender, race, class, socioeconomic status, and so many other identities, and how that plays out for them, how they enter the counseling space, how they exist in the world, and that we need to recognize the connection between those identities in coming up with culturally responsive and individual interventions for our clients. And here, this slide just outlines a few within group differences examples to name a few. And specifically, I focused on trauma and resilience because I think those are of extreme importance in our world. There were also the topics for the course that I've referred to and the assignment that we created, because there are culturally different ways of responding to trauma or experiencing trauma. based on cultures that our clients are from. And one of these differences involves the notion of individualism versus collectivism. I'm specifically going to focus on, in this case, the recent discrimination, racism, and hate crimes that we've seen against Asian Americans over the past month or so. That, again, for some was a racial reckoning, for others is another day that ends in Y, but I think has definitely been heightened. And I was speaking with one student in our program who's a mid-20s Korean woman, and she was talking about how she lives alone, and I asked her, "Oh, how is that for you? Or how safe do you feel? Are you okay?" And she talked about it a little bit and mentioned that her parents were going to visit from Korea because of what's going on, because of they're worried for her safety. They're worried based on the discrimination that she may be facing. I'm like, oh wow, that's very nice of them. How do you feel about that? And her response was, I'm worried about them. That she's worried specifically about her mom, who does not speak English fluently, and that's one example. And I bring up that example to point out the difference between individualism and collectivism in understanding and experiencing trauma, because for this student and several others that I've spoken with lately, when asking them how they're processing the anti-Asian hate that is going on, they immediately discuss their parents, they discuss their relatives and their elders, because of how in their specific culture, that value of elders and thinking of them first is the primary focus. And that if you, in a counseling space, if a counselor were to speak with them, oh, are you safe? Are you okay? What do you have? How do you feel? That would have that may not have the same weight as referring to their community. I know in this example, I focused on this specifically the Asian community, and that collectivism, is not unique to the Asian identifier. It is part of many other cultures as well, and there are also elements of individualism. But understanding how our clients experience and process their trauma, what they worry about. One other element and level that this plays out in is with religion and spirituality, that different groups, religion or spirituality has a different role for all of our clients, and how they process, and what they look to for support, what groups they look to, what powers they look to, and what works for them. There are also cultural perceptions of resilience, specifically surrounding emotion, that in some cultures, verbally expressing your emotions is frowned upon, whereas in others, specifically in our Western culture, and anyone who has been in a counseling program, and that in the US, the most common question that you talk about is ask your clients how they feel, connected to their feelings, have them talk about their feelings. For a lot of people, talking about their feelings isn't something that they know how to do, because in their culture, it's not something that is accepted. Whereas that emotion and that resilience and that trauma, it may actually be connected to somatization, that when a client may say, oh, I'm so tired today, or I have a really bad headache, or my legs have been hurting lately, to recognize that somatization, in some cases, not all, but maybe a manifestation of the emotions that they are not able to or unwilling to express verbally. Lastly, this notion of locus of control. Again, in our Western society, we focus on what's known as an internal locus of control, where we have the ability to influence our outcomes. And that for us, that's self-efficacy. That's one of our values in this Western society. But for clients from different cultural backgrounds, that may not be the case, where the idea of actually having an external locus of control is their way of resilience, saying, oh, I don't have control over this, and that's okay. That for them, that's how resilience may be promoted. And there are several counseling implications here, specifically in recognizing that I'll speak for myself here as someone who is an Asian American, but grew up in this country, was educated in this country, and graduated from a counseling program in the US. We are taught from a Western epistemological framework. Specifically, the theories that we use, they were developed and normed in Western society, specifically Western white male society. And the techniques that we use come from that. And that when we work, and that's based on the cultural conditioning, that the values that we promote in our counseling programs and with students comes from that same Western epistemological framework. And that our role is to move beyond those theories in many cases, understand, or not move beyond, but to apply those theories to the clients that we are working with in a culturally responsive manner. I put this image here again from the MSJCC of recognizing that it's about the attitudes and beliefs, knowledge, skills, and action that we take for each client based on their culture, their background, and what they need. So how do we do this? How do we move from that culturally incompetent counseling towards multicultural competent counseling? The first step is we need to teach our students. We need to challenge their preconceptions and their stereotypes, which is where we come in as counselor educators. And for those of you in the field, that's a process of continual self-reflection, constantly challenging, why do I believe what I believe? Where is this thought coming from? Where are our beliefs coming from? Because again, from a systems level, we are all culturally conditioned to think certain things that may not work for our clients. And in this specific case, we need to learn how to discuss race, culture, ethnicity, gender, sexuality, socioeconomic status, etc. in counseling spaces. One thing that I know that I'm now a teaching assistant in our diversity course is people do not like to talk about these topics. Because our culture, that's taboo to talk about those differences, and we need to be talking about them with our clients. And one way to do that you may be familiar with is the concept of broaching, which was developed by Dr. Dave Vines and her collaborators of how do we take those topics, how do we talk about them in a counseling space to broach those differences between counselor and client, to understand how our clients exist in the world, and to bring it back to what I mentioned at the beginning of why many BIPOC clients have their lower return rates among that group in counseling. Broaching, when counselors broach, they found that there was a higher return rate from clients when counselors broach. So it is so imperative and important to discuss identity, identifiers, and differences in the counseling space. And with that also comes learning the importance of intersectionality, of how once you learn and unpack what identifiers mean to your clients, how do you connect them together and develop culturally responsive, resilient strategies, counseling interventions, and advocacy strategies for them. And I also put in this image here of any counseling student is probably way too familiar with Uri Brown from Brenner's ecological systems theory and the systems level advocacy model, and how we as counselors move from the individual to the microsystem, mesosystem, exosystem, and macrosystem, working from what the client tells you in the counseling session to what they go home to what is in their communities, and to society as a whole, of what we need to do as counselors to advocate for them. So I said a lot of probably aspirational things, and the question you'll be asking is, great, cool, how do we teach this? How do we do it? It's important, but how do we do it? And so now we're going to spend the remaining time we have walking through how to do it, as well as briefly touching on the assignment that we developed to do it. And it starts with reading background knowledge and then applying that knowledge. So we ask students to read about, in our case, how different groups experience trauma and what different groups need for resilience, and have them apply it in a culturally appropriate and specific manner. And then once we do that, we're seeding feedback to build communication skills around race, culture, and advocacy. That I said, these are oftentimes uncomfortable conversations, and the only way to get better at them is to have them, to have those courageous spaces, to enter those brave spaces, to continue having them. And then extending and understanding that awareness by viewing their peers' perspectives. The best way to learn is from each other. That's for students in counseling programs. The best learning doesn't happen from a professor giving a lecture. It happens from students giving each other feedback, seeing each other's presentations, and having that experience of talking to another person to have that self-reflection. And lastly, to create opportunities for discussion if students fall into that monolith myth trap. So this was the assignment that we created we called the Trauma Protective Factors Conference. And this assignment was done in two parts. The first part was a conference presentation where we asked students to review assigned material, reflect, and respond to a series of guide questions on culturally sensitive resilient strategies to promote client wellness. And the reason that we did this, as we created a virtual conference, much like what is happening here over the next few days, with the idea being we wanted students to have that practice of speaking about these topics and speaking to each other about these topics. So we asked them to apply their learning we asked them to apply their learning, and specifically we wanted it to be timely and relevant to look at a specific group impacted adversely by the COVID-19 pandemic and connect it to their work in counseling, and focus on the protective factors, resilience, systemic racism, and how they would discuss advocacy. And the second piece of the assignment was reviewing peers' presentations. Again, that the importance of viewing others' work and feedback. And in the professional counseling space, that's your supervision, where after meeting with your client, speaking with a supervisor or peer supervision of, hey, this is how this went down. What do you all think of this? How could I have done this better? Getting that feedback, because we grow through feedback. So after creating and viewing the presentations, we asked the students in the course to evaluate their peers' work by viewing their presentations and reviewing it, discussing their main takeaways, strengths, areas of growth, and then have a conversation with a thought-provoking question that I brought up for them around the topics of the presentation. And it was interesting what we found when we did this is, again, we specifically asked students who were at the end of their program to identify a specific group and discuss a specific group. Yet 30% of them fell into the monolith myth trap, where rather than focusing on a specific group or a specific client that they would be treating, they fell into the trap of saying, oh, this is how I would advocate for people of color. This is what I would do for BIPOC clients. This is what I would, and speaking in broad, vague, and general terms, which to us was concerning, that we are a program that ostensibly prides itself on its multicultural training, its diversity and social justice, and we're finding that students who are about to leave our program and enter the counseling field did not understand or appreciate the nuance and difference within and between groups. So what we did, which we did not expect to have to do, was we used it as a teachable moment by highlighting the diversity among presentations. The 30% of students who we felt fell into this monolith myth trap, what we told them to do is go view the rest of your peers' presentations and go see what you find, because we had such a diversity of presentations showing different groups and how they were impacted, different resilience strategies. Again, I'm reminded of one student's presentation. She focused on the Indigenous population, and a lot of her resilience was focused on spirituality and the importance of spirituality in that community. Whereas other presentations did not focus on religion or spirituality, because in those communities, that is, does not have the same cultural weight in those communities. So we asked the students to go back and view those presentations to see the differences that within and between groups, because we wanted to show students how they did not use culturally responsive advocacy strategies when they were using that one-size-fits-all approach. And by doing that, it helped us adjust the assignment directions for the future, that this course will be taught again in the fall, and we're already adjusting the assignment instructions and parameters to make sure that students know not to fall into that monolith myth trap. So going back to why are you here? What is the point of you, viewing this presentation? Because it's about how you can do it yourself. It's how do you take this idea and this model, bring it to your courses, or for those of you who are students, how do you go to your courses? How do you adjust your thinking? What are you thinking about? And for those of you who are in professional counseling spaces, how do you treat your clients who are maybe experiencing that toxic stress, that racial battle fatigue, or come from other marginalized groups, to ensure that, going back to the MSJCC, that if you're in a space where you're working with a marginalized client, how do you have the attitudes and beliefs, skills, knowledge, awareness to take the actions that your clients need? And here are the steps that we found that can work. And it starts with finding background reading on multicultural implications for your topic. So for us, our topic was about trauma, stress, and resilience. So we found background readings that discussed what trauma looks like in different communities, how different communities process their trauma, how different resilience strategies that are connected to protective factors that are applicable in specific communities. And then we asked them to look at how do you advocate? What does advocacy look like in those spaces? And I know that's very counselor education specific. So for those of you who are professional counselors, psychologists, social workers, school counselors working in the field, what reading are you doing? What are you reading? What are you watching? What are you reflecting on? What conversations are you having with your colleagues, with your peers that promote understanding clients from a multicultural background? Secondly, the step 2, and this is pretty specific to counselor educators, is to create an assignment in which students apply culturally sensitive interventions and advocacy strategies. And I want to stress here, this can be done in any course. For us, we did this in a social and personality psychology course. One thing that I know in my training program, I found that I took issue with was every single course had what I tongue-in-cheek named Diversity Day, where for one day of the class, we talked about diversity. And how it applied to the class. It needs to be more than that. It needs to be infused into every lesson, into every assignment, and that in any course you teach, there is a way to incorporate culturally sensitive interventions and advocacy, and how it plays out in the course topic that you are working with. The next step of it, after an assignment is created, is once to bring in other voices and have that peer feedback, where allowing peers to review their classmates' work not only teaches how to communicate and build that skill set of communication around race, culture, ethnicity, and other identifiers, it teaches the process of feedback while simultaneously encouraging reflection, which shows the importance of considering the heterogeneity within groups and unpacking and understanding how do we recognize the differences that our clients have, and how do we know when we're falling into a monolith myth trap, because the last step of this is to foster discussion surrounding the strengths of this assignment and key takeaways for students. After we went through this process, we opened up a discussion forum where we said, hey, this is the first time we've done this assignment, and we're curious, how was it for you? What did you learn from it, to make sure that we met our goals in teaching the skills we were hoping to teach? Because what's important from this type of work for students is to recognize when they hold bias and fall into the monolith myth trap, but also to tell them that's part of your learning and growth, and that them falling into this trap is a sign of cultural conditioning, that it's part of the systems level systemic understanding that comes from. And for them to then say, okay, this happened. How do you now see the importance of within and between groups differences in experiential format? And lastly, how they can gain the tools for culturally sensitive interventions and systems level advocacy. So I have said a lot about several different topics that I hopefully connected in a way, and I want, in the remaining time that we have together, I want to open it up for questions. So you can put your questions in the chat, and we will get to as many as we can.
We had a question earlier asking if you would be sending out the PowerPoint for reference.
Yes, we can definitely send out the slides to everyone afterwards. Yeah, if you have any questions, please feel free to unmute yourself or put them in the chat. We have a few minutes left. See, we have a question in the chat. So I'm wondering what barriers you see to exist in getting counseling programs to teach from a non-monolithic approach. Why is the monolith approach so common? I think because it's two things. One, it's easy, and two, it's what's historically been done. One thing that I know that I've seen in the past year is there's been a lot of conversation about dismantling and decolonizing our curricula and moving towards what and looking at, and from the simplest level, thinking of, oh, which textbooks are we using? Whose work are we citing? And seeing, do they reflect our current society? Do they reflect what our clients need, need in current times? And looking at which scholars, how can we add to the existing curriculum? How can we apply the theories that we're learning? How can we apply them to a client base that they were not normed on? How do we adapt them? But also, how do we develop new ones? I think we've seen so many, we're now on the 5th wave of therapy, I believe is where we're at. How do we infuse those new theories into our courses, and how do we blend them together? So to answer the question of why is the monolithic approach so common? Because it's just what's been taught historically, and how I think the barriers comes from the general telling people that, hey, what used to work doesn't work anymore because the world is different. The world is not what it was when counseling as a field was developed. It's not what it was when these theories were developed, and that we need to be responsive to advocate for our one thing that I know that that I've seen lately is understanding what does anti-racism look like in counseling programs, moving from this idea of a singular diversity social justice course to having additional courses surrounding this topic on anti-racism, and specifically going from talking the talk to walking the walk, of moving from those attitudes and beliefs, skills, and knowledge to action, and getting people to doing that. So we have another question. Do you think that programs should offer specific information or knowledge about how to work with each BIPOC or LGBTQ identity in order to avoid a monolithic approach? I wonder how this might run the risk of stereotyping. For example, should counselors in training be taught approaches? So thank you for that question. That's such a great question, because it's so easy to, rather than falling into the monolith myth trap, to fall into another trap of stereotyping. When we view people from any one group as, we go from viewing the full BIPOC group as a monolith to then viewing individual groups as a monolith. So in the question here, he says, specifically working with Black clients compared to Asian clients, how do we avoid the risk of stereotyping them? And that goes back to, I think, the graphic I had of intersectionality, and that notion that there are more within group differences than between group differences, and that how do we use broaching and other counseling skills to understand our clients from an individualized and holistic framework of what works for them specifically, that understanding resilience strategies that may be typical in certain communities may not be specific to our clients as well. So we have to do both, I would say. We have to understand and appreciate the nuances between groups, but we also, just as importantly, if not more importantly, have to understand and appreciate the differences and nuances within those groups and with each specific client for what works for them. But it comes from that first big picture meta understanding of, okay, culture matters. People from different groups, it matters how they identify, because that determines how they show up in the world and how they exist in the world and how they process their experiences. So I see we are just about at our time. So what I want to leave you with is this last question that I hope you take away from this presentation is, how can you incorporate this model in one of your courses or in your professional counseling practice? How can you take the idea of the monolith myth and reflect on it? How can you use it to help the students in your courses? How can you teach this to them? Or for those of you working in the field, how can you make sure that you, your colleagues, your interns do not fall into the monolith myth trap and treat clients the way that we need to treat them to give them the care that they deserve? Because again, going back to how I started, what we do, it's a privilege to do what we do. So thank you so much for coming, for spending part of your day here with us. It means a lot to see so many faces here. If you have any questions, you can contact me at my email address here, and we will also be sending out the slides to all of you. Thank you. Here are just the reference lists.